How you doing, Dr. John?
I'm doing good.
See, I got so familiar with you, I wanted to call you John, but it's Dr. John.
Either way is good.
Can you explain to us who you are and what it is that you do?
Sure. I've got a couple of roles. First, there's a cancer program that we're setting up. I'm in charge of the program, and that's to coordinate a clinical trial research program focused on bringing into Northwest Ohio precision technologies. These are new treatments that have been developed over the last 10 to 15 years, and we feel that it's going to be a great opportunity for patients in Northwest Ohio.
So you're a patient, you figure out, hi, I have this really rare form of cancer, chemotherapy wasn't quite responsive, and then I decide I'm going to go into testing. Is that done here or somewhere else?
Yeah, so the testing for the precision technology therapies is a type of genetic testing. You could look at the DNA, you can look at the protein, and these tests can be started and finished within a week's time. And we can now strategically plan out what genes are causing the cancer and how to stop those genes from working. And so precision therapy is all about identifying that particular defect in a patient's cancer and then developing a technology or bringing on board, some of these have already been approved by the FDA now, bringing them on board to treat that patient. Many scientists doing this work, but I've had a chance to work with them as well as a lot with the FDA and a lot with the biopharmaceutical industry. And we've learned in ovarian cancer that young women you would think would respond well to many of our treatments, and they do to some degree. But we've had a lot of trouble curing patients with our standard approaches. But recently, related to a company that I actually set up and many great immunologists, we've learned how to impact the immune system and what sort of doesn't seem to be going right. It's related to a combination of immune activities that we can build into a cancer cell from that patient, irradiate it so it doesn't grow anymore, and then that cancer cell, the product is called Vigil and the company is called Gridalis. That cancer cell then it won't grow, it'll actually stimulate the immune system to attack it. And when it attacks that modified cancer cell, the genetically modified one, it'll now spread and educate the immune system to attack the rest of the cancer in the body. We saw the most responses in ovarian cancer, so we pursued working with the FDA on this product much longer in ovarian cancers.
What is the success rate or life rate, I'm not even sure what to call it, of someone who is diagnosed with ovarian cancer before versus after your therapy?
It can come back in about 75% of the patients within 2 years. And that's the problem. Once it does come back, it's now got a much better hold and it's more resistant to our standard treatments and it's more difficult to treat. And so most patients only live a couple of years after it comes back. And so our focus and where our one of the technologies that I'm very familiar with is Vigil technology. There are others, but the focus is to try to prevent that cancer from coming back.
What you're telling me is that this is really groundbreaking therapy.
Yeah, I believe it is. Every patient, you yourself, what you want is that therapy that works, that therapy that cures you. Now, we can't always get something that cures you, but as long as we can get it to where we don't have the cancer, seen, it can't be felt. It's like hypertension, it's like high blood pressure. Many people are on high blood pressure medications for many years. It used to kill people with heart attacks years ago before we had the blood pressure medication made. But now you can live a normal life and not have any problems. That's where we're taking cancer. I believe precision technology, the study of genetics, will allow us to get there over the next 10 years.